Good morning or afternoon, depending on where you're joining us from, and welcome to today's webinar on curbing unhealthy marketing in schools, brought to you by ChangeLab Solutions and the Alliance for a Healthier Generation. We want to thank you all for joining us today and also give a huge thank you to the Robert Wood Johnson Foundation for making this webinar possible. As a reminder, this webinar is being recorded and will be made available to all of you. My name is Alexis Eto, and I'm a staff attorney at ChangeLab Solutions. I'll be moderating today's webinar, and I'm thrilled to introduce our three speakers. Joining us today, we have Sabrina Adler, who is a senior staff attorney here at ChangeLab Solutions. She works primarily on legal and policy issues related to school foods and food marketing to children. We're also pleased to welcome Stephanie Joyce, who is a National Nutrition Advisor with the Alliance for a Healthier Generation. As a registered dietitian and school nutrition expert, Stephanie helps support schools and sites create healthier food environments. And finally, Elizabeth Pratt is the program manager for Maine SNAP Ed. Prior to this position, Elizabeth was the school health coordinator for Portland Public Schools. Today she'll be talking about her work updating their wellness policy and removing non-compliant food marketing. Before we dive in, this is just a quick background on ChangeLab Solutions. We're a national nonprofit public health organization based in Oakland, California that creates innovative laws and policies to ensure everyday health for all. These solutions address all aspects of a just, vital, and thriving community like food, housing, childcare, and as we'll talk about today, schools, transportation, public safety, jobs, and the environment. Because several of us on staff are attorneys, including myself, we have to include this disclaimer that just says we're not providing legal advice. Rather, the information provided in this training is for informational purposes only. All right, so here's what we're going to cover today. To set the stage, we'll first talk about the significance of marketing in schools and why it's a problem. We'll next explain the USDA final rule and what it requires. Then we'll talk about some of the ways school districts can go beyond the rule's baseline requirements to address food and beverage marketing. We'll also point out some resources available to school districts in working on this issue. Finally, we'll hear about research and findings from a project to address school food marketing in Maine. We'll also have a chance for Q&A at the end, so we encourage you to type any questions you have into the chat box. And now I'd like to turn it over to Sabrina to take it away.
Thank you, Alexis. So I want to start by setting the stage and talking a little bit about something that might seem obvious, but that is why marketing in schools is a problem. So here on this slide, you can see that $1.8 billion was spent on marketing to children and youth, and this is from a Federal Trade Commission report published in 2012 using data from 2009. And most of that marketing promoted unhealthy foods and beverages. In addition, marketing for unhealthy foods and beverages disproportionately targets Latino and African American youth who are also hardest hit by diseases like diabetes and obesity. And with respect to food marketing generally, research has demonstrated that companies' marketing tactics affect children's food preferences, their purchase requests, so what they talk to their parents about buying to eat, and their eating patterns. And obviously all of those things can affect their current and future health outcomes. So when we're talking about schools specifically, there was $149 million spent on marketing in 2011. And the majority of that spending, 93%, was for beverages, so sodas, juices, etc. Most kids are exposed to food and beverage marketing in school, and marketing in school can take a variety of forms. So in its more obvious forms, it can be found, for example, on the front of vending machines or on scoreboards or on book covers. But it can also take the forms of things that maybe are less obviously marketing, like coupons that are handed out as rewards, or branded educational materials that teachers use in the classroom for learning, and even more. And I know Stephanie, who's going to talk in a minute, is going to talk a little bit more about the various types of marketing found on campus to give some examples. So before I talk specifically about why this is a problem, I want to pose a question to all of you. So get ready, it's a time to be a little bit interactive. And though you can't speak, you can type things into the chat box. So make sure that you select broadcast to all so your comments can be seen by everybody. But the question I want to pose to you all is, why do you think marketing in schools is a problem? And I'm going to pause for just a little bit so I can see some of the answers. And then I will talk a little bit more. So go ahead and type things in. Great. So I'm seeing some answers come in. Money, deviating attention from child nutrition programs, children easily influenced by marketing. Yes, I'm going to talk a little bit more about that in a minute. Competing with school food service. It depends on the marketing. Marketing fruits and vegetables can be a good thing. Psychological costs, health costs, influencing student choices for capital gain. So these are all really great points and showing that the audience is very well informed about this issue. What I want to talk a little bit about, and you can keep typing in answers here, is the piece about kids being uniquely susceptible to advertising. So limits on food and beverage marketing in schools are particularly important for a variety of reasons, but one of them is because kids are uniquely susceptible to advertising. They don't have the cognitive ability to understand that advertising presents a biased point of view. So older kids and teenagers can understand the intent of advertising. They get that it's trying to sell them something, but they're often still too young to understand its effects. And resisting the type of advertising that happens in schools for unhealthy foods requires the ability to weigh long-term health consequences of consumption against short-term rewards. And that's a pretty complicated cognitive task and an ability that most people don't develop fully until their early 20s. So as I noted before, children that are exposed to marketing for unhealthy products are more likely to consume them, which can lead to increased consumption of foods that have little or no nutritional value. So all of this, coupled with the fact that students in school are a captive audience, that's a point that somebody else made, which is great. They don't have the option but to be there, and they're in a place that's supposed to be devoted to learning, as a lot of other people pointed out. And that learning is supposed to be including about healthy practices. So all of that means that it's critical to address unhealthy marketing in schools. And as you'll also hear in just a moment, doing so is now not only something that schools should be doing, but is a requirement. So I'm going to turn it over to Stephanie now to talk a little bit more about those requirements, and I'll be back with some additional information in a few minutes.
Thank you, Sabrina. Good afternoon. As Alexis mentioned, my name is Stephanie Joyce, and I'm a National Nutrition Advisor with the Alliance for a Healthier Generation. Founded in 2005, the Alliance believes all young people deserve a chance to live healthier lives. We work to empower kids to develop lifelong healthy habits by ensuring the environments that surround them provide and promote good health. Today, 1 out of every 3 children and adolescents in the United States is overweight or obese, putting them at risk for serious health problems. Research shows a strong link between a young person's practice of healthy habits, including a good diet and regular physical activity, and an important improvement in their overall life outcomes. We work to provide tools, resources, and training to the people who work where kids and teens live, work, and play. So let's take a look at the timeline of how schools got to where they are today. In 2004, when the Child Nutrition Reauthorization was passed, school districts were required to adopt local wellness policies for the first time. And in 2006, the Alliance released competitive food and beverage guidelines that were the first set of national nutrition standards for all of the extra foods and beverages sold at schools outside of school meals. In 2007, the Institute of Medicine released their standards for foods and beverages available at school. And in 2010, the Healthy Hunger-Free Kids Act was passed. It was released as a part of the First Lady Michelle Obama's initiative to update school meal standards that were revised for the first time in decades. This is where we saw much-needed revisions to the school breakfast and National School Lunch Program meal patterns. In 2013, the interim final rule of Smart Snacks in School was released and went into effect July 1st, 2014. And most recently, in July 2016, the USDA's final rule on local wellness policies was released. These regulations strengthened components of what local school districts are required to include in their wellness policies. The final rule is the federal law or regulations that require school districts participating in the National School Lunch Program to adopt a revised local wellness policy, meeting all of the required components by June 30th, 2017. For the purposes of today's webinar, we're going to review one of the new areas that for the first time ever is now required to be in your local wellness policy as a part of the final rule, food and beverage marketing. Language direct from the USDA's final rule on local wellness policies state that policies may only allow marketing and advertising of only those foods and beverages that meet the Smart Snacks in School nutrition standards. This means that any food or beverage marketed on the school campus during the school day must meet the Smart Snacks in School nutrition standards. These are the nutrition standards schools are required to follow for any food or beverage sold to students outside of reimbursable meal programs, such as school breakfast or lunch. For example, these items are typically sold in vending machines, school stores, snack carts, or a la carte. Food and beverages sold outside of school meals must meet general standards in addition to limits that are set on calories, fat, sugar, and sodium in order to be sold to students during the school day. And the USDA has defined the school day as midnight before to 30 minutes after the end of the instructional school day. So if the final bell rings at 3 p.m., these guidelines must be followed until 3:30 p.m. So what exactly is food and beverage marketing? Marketing is advertising or other promotions in schools. It includes oral, written, or graphic statements. The USDA specifically addresses what food and beverage marketing is in the final rule. It is defined as any of these oral, written, or graphic statements made for the purpose of promoting the sale of a food or beverage product made by a producer, manufacturer, seller, or any other entity with a commercial interest in the product. I want you to recall the last time you walked into a school building. What did you see for food and beverage marketing? Were there any posters on the wall, vending machines outside of the cafeteria, or scoreboards in the gymnasium or out on the athletic fields? I want you to take just a moment and type into the chat box for us and tell us what some of those examples are that you see for food and beverage marketing or advertising on school campuses. So when you type into the chat box, go ahead and select Broadcast to All like we just did with Sabrina so we can see some of those examples here. I'll take just a few seconds while I wait for those answers. So we see some energy drink, Powerade signs, concession stands at high school games, Pepsi, they have water, there is a water vending machine, Coke signs, discounts for unhealthy foods, scoreboards, vending. Yeah, so we've seen concession stands again, ice cream freezers, absolutely, murals actually with fast food characters, coupons for food and beverage that are included with report cards, commercial signs such as the Pepsi sign illustrated. Yes, those are great examples and all of things that we do see on school campuses. Thank you for sharing those examples. So I think you guys definitely covered a lot. But we definitely see all of that food and beverage marketing. It's very common within school buildings and campuses. And we've even seen it on school buses or other vehicles that are used to transport students and on athletic fields or stadiums. And this could be through school scoreboards, coolers, cups, and even water bottles. There's a few pictures here on the slide for examples. We covered a few in the examples you all shared. There's vending machines, cafeteria coolers, and even some pizza warmers. Someone had mentioned the ice cream freezers. There's even outdoor kiosks and scoreboards that will include advertising on occasion. There are also advertisements on the side of school buses and posters that promote those fundraising programs, and a few people even mentioned reward programs too, going home with report cards. Some other examples that are not included here in our pictures are menu boards, coolers, trash cans, and other food service equipment, as well as cups used for beverages. A simple way to remember what the new food and beverage marketing component means is if you can't sell it, you can't market it. So if schools cannot sell the food or beverage because it does not meet the Smart Snacks nutrition standards, then schools cannot market it. This is a great way to remember what the final rule means for food and beverage marketing. And I encourage you to write this down to share it with others. And just to remember that if you can't sell it, you can't market it. So what's not included? These standards do not apply to marketing that occurs at events outside of school hours, such as after-school sporting or any other events, including school fundraisers. However, states or local school districts may choose to extend the standards to these events or times of day as well. So that's something to keep in mind and to be aware of, that your state or local policy may say otherwise. This rule does not establish limits on personal expression, opinion, or products. For example, this would not apply to clothing or personal items used by students or staff, or the packaging of products brought from home for personal consumption. This rule does not apply to materials used for educational purposes, such as soda advertisements as a media education tool, or a health or nutrition education curriculum. And lastly, schools are not required to allow food and beverage marketing. However, if your district does choose to allow it, it must be limited to only those items that meet Smart Snacks. I'm going to share a couple of examples of some school districts that we've seen include this language already in their local wellness policy. One of our Healthy School Program school districts, Central Unified School District in Fresno, California, revised their local wellness policy this past January. And among other updates, they included language to address food and beverage marketing in order to be compliant with the final rule. And one of our National Healthy School Program Gold Award winners, Alvord Unified School District in Riverside, California, revised their policy in 2015 using our model policy, which I'll mention in a bit when we cover resources. And they included language here to include the food and beverage marketing. I'm going to pass it back over to Sabrina.
Thank you, Stephanie, and thanks for those examples. So as she mentioned, at a minimum, school districts have to revise their wellness policies by June 30th, 2017 to prohibit on-campus marketing of foods and beverages that fail to meet the Smart Snacks food standards if they don't already have a marketing provision in their wellness policy. And as Stephanie mentioned, one thing I want to talk about for the next couple of slides is the fact that states or local school districts can choose to go beyond those minimum requirements set forth in the final rule. So while that rule provides a minimum standard for school districts, it doesn't spell out a lot of the details. And filling in the details is likely going to be where schools and school districts need the most help from a policy perspective, particularly if they want to go above and beyond those baseline requirements to address food marketing more comprehensively. So for example, when revising their policies, schools might choose to include brand marketing or to incorporate requirements that extend beyond the school day, or address marketing of off-campus school-related activities, or they might want to include lookalike snacks, or ban all food and beverage marketing on campus, or even all marketing on campus. So I'm going to talk a little bit more about a few of those options now. So first, as Stephanie mentioned, the USDA rule defines marketing as oral, written, or graphic statements made for the purpose of promoting the sale of a food or beverage product. These statements are typically made by the producer, manufacturer, seller, or any other entity that has a commercial interest in the product. But there are many types of marketing that appear in schools. School districts crafting policies will have some flexibility and leeway to determine what should be included in their policies and how to define marketing. So for example, schools could craft language to ensure that things like coupons or box top programs are covered, in addition to the more traditional signage, vending machine fronts, scoreboards, etc. I'm happy to provide more information on this in particular if people have questions, but I also want to flag, and I'll talk about this more in a minute, that we're going to be coming out with model language that will help to address some of these things. I also want to mention brand marketing. So while the USDA rule deals with the marketing of specific products that don't meet the Smart Snack standards, it doesn't directly address the issue of what to do with marketing that's branded but not promoting a particular product. So for example, how would you apply the Smart Snack standards to the Golden Arches? The Golden Arches aren't a specific product, so it's difficult to apply nutrition standards to them. At the same time, a lot of the marketing that's in schools is this type of brand marketing. So not addressing it could mean that a fair amount of what is essentially unhealthy food marketing would persist. And it could be an exception that in some ways swallows the rule. So one option to address this is to take a hard line and say that a brand can't market in schools unless all of the products sold under that brand meet the Smart Snack standards. If a brand doesn't meet that requirement, and most non-produce or non-water brands probably won't, then they have to advertise a specific product that does meet the Smart Snack standard. So that can be a little complicated. Let's take an example here. Coke, which is a large brand, could advertise its smaller brand, Dasani, because all of the products sold under that brand name meet the Smart Snack standards. It's essentially just a line of water. But McDonald's, which certainly sells products that don't meet the Smart Snack standards, could only advertise a specific product that does meet those standards, like apple slices. It couldn't simply put the Golden Arches on a scoreboard. So that's what addressing brand marketing would accomplish. There are other ways to address this issue. So for example, you could set a lower threshold. You could say brands could advertise if, say, 50% of their products meet the Smart Snack standards. But the problem with that is that it can be very difficult for schools to implement and enforce because nobody's out there calculating what percentage of a brand's products meet the standards, and the schools would have to do that calculation themselves. So an all or nothing approach here is definitely simpler and probably more effective. The last thing I want to talk about is lookalike snacks, which you might also have heard of referred to as copycat snacks. So these are products that have been reformulated to meet the Smart Snacks food standards, but they're packaged like the original food products, which don't meet the standards. So you can see the various columns on this slide, and thank you to the Red Center for this helpful graphic. So for example, a reduced fat Doritos product may be sold at school if it has been reformulated to meet the Smart Snacks food standards. However, this can be really misleading for students, staff, and parents because the packaging of that reduced fat Doritos product is nearly identical to the packaging of the original, more ubiquitous Doritos product, which has minimal nutritional value. The product's nearly identical packaging is particularly problematic because the lookalike snacks are not usually available for purchase outside of school. Only the less nutritious but similarly packaged counterparts can be found in stores. This can lead children to buy or request the less healthy product when they see it outside of school, and it essentially serves as a form of marketing for these products in school. So lookalike snacks are not covered by the USDA final rule, but school districts could definitely choose to address them in their policies. They can insert appropriate wellness policy language to prohibit the sale or provision of these products to students. So for those who are finding these options overwhelming and confusing, and they can be overwhelming and confusing, you'll be happy to know that we at ChangeLab Solutions are developing resources, including a fact sheet and a model policy with language that meets the baseline standards, but also includes options if school districts wish to go above and beyond, and to help them fill in the details around the final rule and around addressing marketing. So these resources are going to be available on our website soon, and everyone who signed up for this webinar should receive an email about them when they are available. I also want to note that for those working at the state level, we have a model statute that can be enacted by a state legislature, and that is currently up on our website. So this is an area that can be dealt with on the district level, but there's also the opportunity to enact state laws around it. So now I'll turn it back to Stephanie, and she's going to talk about some additional resources available.
Thank you, Sabrina. To support schools and districts that will be making revisions to their wellness policy in order to be compliant by June 30th, the Alliance created a model wellness policy. Our model policy that was referenced in the USDA's final rule as a resource to use is a template schools can download and edit to meet their needs. This resource was created in collaboration with the CDC, USDA, and other national partner organizations to create a robust policy districts can use as a starting point in their revisions. The policy includes all language required in order to be compliant with the final rule, as well as some additional sample language options that districts can pick from if your district is ready to go above and beyond these standards. You can access this resource by visiting our website, healthiergeneration.org, and selecting Take Action, Schools, and then visiting our Wellness Policy page. You can also search in the top right-hand corner from our homepage. And I'll hand it over to Elizabeth. Thank you.
Thank you. So can you hear me? I want to make sure it's working.
You can, thanks.
Great. So I wanted to talk a little bit about a study that I participated, that I was involved in from 2014 to 2015. But also wanted to mention that when I had this role, I was a school health coordinator for the Portland Public Schools, and we also did a lot of work with the wellness policy. And so we did work to make it compliant with the final rule, and we added language about the smart snacks. But in this, sorry, go ahead. In this example, I'm going to be talking primarily about a study that I was involved with. And I want to first acknowledge Michelle Polachek. I'm clicking on the second slide. Oh, okay. So Michelle was the principal investigator for the study, and the research was supported through a grant from the Healthy Eating Research, a national program of the Robert Wood Johnson Foundation. So with this study from 2014 to 2015, we looked at compliance with what was likely to become the new Smart Snacks federal standards. And so we assessed marketing in 3 different schools, 1 elementary, 1 middle school, and 1 high school. And I'm going to walk through and give examples of the work that I did in those 3 schools. We provided technical assistance to the schools and walked through an improvement process with them. And then Michelle also looked at the digital marketing exposure, but I'm not going to address that as part of this presentation. So what I'll be focusing on is the 3 schools in Portland, Maine, and talking about first what we found in the 3 schools and then how we addressed it. So this is an overall graph that just shows you the baseline assessment. So there were 2 baseline studies completed, one in the spring of 2014 and one in the fall. And even though you can see there's a difference in the overall marketing, the not compliant marketing that was found stayed the same in the spring and in the fall. So first I'll give examples from the assessment that was done in Portland High School. And this is a large urban high school in downtown Portland with a very diverse population of students from 41 different countries. And here are the instances of the types of marketing that were found in Portland High School. So as you can see here, even when there are a lot of instances, it's the NC, the non-compliant instances, that we're most interested in. So in Portland, in the high school, you can see that most of the marketing is on posters and signs, and some of those were restaurant night posters and coupons that were on posters and poster boards throughout the high school. and most of the non-compliant marketing was on the vending machines. So next we went to the middle school, and this is a middle school called Lyman Moore, and the students at Lyman Moore they're in grades 6, 7, and 8. And I'll show you what we found at Lyman Moore. So again, most of the marketing that we found was compliant. There were a lot of instances on posters and signs, and the non-compliant marketing was primarily on the vending machines. The third school was an elementary school in Portland called East End Community School, also another urban school with a very diverse population. So here with the elementary school, we found very little non-compliant marketing, and I'll give you some examples of what we did find as I describe the improvement plan for each school. And this shows you overall, in all the 3 schools, the 10 most frequent products marketed in the school. So on the left, you'll see all the products that were found. And that first example is 5210. That refers to the Let's Go 5210 program that we have in Maine. So that's very healthy marketing. So we kept a list of both compliant and non-compliant. And then you can see in red what marketing was found that was not compliant. And this slide is just an illustration so that you can see just some examples of some of the marketing logos that we found. So now I'm going to go into what the improvement plan process was. I think the most important thing to point out is that this was a half-time position for a school health coordinator. That's an important part of this process because it did take quite a bit of staff time, and it was also really key that we had a school health coordinator, myself, who was part of the school, so that I had inroads and knew a lot of the staff who worked in the 3 schools. A lot of the work through the school improvement process was to meet with the principals. At first, that was primarily the work was to connect with the principals, but then also to find other individuals throughout the school who had some ownership over the marketing, and I'll explain that more as I give examples. And in some schools, I worked with wellness committees to do this work with them. And then I created an improvement plan for each school and shared that with the staff at the school, and we documented all the changes. So first I'll show you, I don't want to walk through all the details. I realize this is kind of a detailed improvement plan, but I wanted it as a concrete example to show you how we did this work and how we kept track of what the non-compliant marketing was, what our options were for removal, and then some notes on what some of the barriers were. We actually found something interesting in the elementary school that we didn't expect, and it was that there was not a lot of non-compliant marketing at all, but a lot of the boxes, storage boxes throughout the school were from the school food pantry. So we found this actually in the elementary school and the middle school, that they have an on-site food pantry, and there are a lot of boxes with marketing on them. They're not for commercial gain, but this marketing made its way into the classrooms, and what we learned was that a lot of the teachers used those boxes because they didn't have any other option. So what our strategy was in this study was to purchase clear plastic bins for the teachers to remove, so that they could remove the cardboard boxes and use something that didn't have marketing on it. So the middle school was interesting. Like I said earlier, most of the marketing was on the vending machines, and we also found some marketing on a scoreboard in the gym. For the vending machines, it was actually a pretty smooth process because we worked with National Beverage, and they were they worked really well with us, and they were very willing to replace all the panels on the vending machines for free. And what they did was they took the non-compliant Snapple marketing. I'm sorry, this picture is not very big, but you can see that it was Snapple marketing that was not compliant with the final rule, but then they changed them, and then the one that they put in says 100% juiced. So just like you heard earlier in the presentation, it's the same company, still says Snapple, but by changing that, it was compliant. And so they did this throughout the middle school and changed all the vending machines. At the bottom, you can see what we found in the gym. And at the bottom left, you can see the scoreboard. I'm sorry, again, this picture is a little small, but you can see the Coca-Cola panels on the scoreboard. And what we did in this case was we worked with the athletic director, and we considered working with him to switch the Coca-Cola for Dasani water. But when we brought up the idea of using their school logo, and the school mascot, the falcon, they got really excited about that, and so we worked with them to get some stickers made of the falcon, and then we worked with them to put those stickers over the Coca-Cola sign. So that actually was a key lesson learned for us because we really tapped into the school pride, and I really strongly suspect that we wouldn't have moved things along so quickly if it had been to replace the Coca-Cola with another form of food or beverage marketing. They were very excited about this, and the process was very quick because they really had ownership over it and felt really excited about the new sign. So for the high school, a lot of the marketing was actually, it was interesting. We were surprised because we didn't find a lot of marketing. But this is partly because the high school is an urban school and they use city-owned facilities for their sports. So there was really limited marketing within the school. The biggest challenge was finding that the city-owned venues were saturated with non-compliant marketing. I don't have a photo here, but that was a key finding from this study, and it was difficult because we couldn't address the marketing that was in the city-owned facilities because we could only focus on the school-owned venues. So where the students who participated in sports spent every day for practices and for other games, they were surrounded by marketing for soda, beer, candy, etc. So that's something that we couldn't address with this study, but in terms of the marketing within the school, we were able to work with the recycling club to switch the marketing on these signs that they made. They're in the cafeteria and they show the students where they can recycle their cans and plastic containers. So we were successful in this school as well in changing the marketing, but we couldn't address the city-owned facilities. So this is just an illustration to show you the changes from baseline to post. And you can see that we were very successful, and there was not much non-compliant marketing when we were finished. And actually, what was interesting is what we did find at the end were some of those food pantry storage boxes. We just couldn't keep those from making their way into the classrooms. Teachers really relied on the empty boxes to store materials in their classrooms. So in terms of resources needed, the school health coordinator was an important component to this, and we found really, really critical to have somebody from within the school district to do this work. We also were fortunate to have National Beverage working with us, and really we found them to be easy to work with because they were very willing to switch the vending panels. The other lesson learned that I did mention was that switching the Coca-Cola sign, I really do feel we were successful partly because they were so excited about the new decal, and that cost was pretty minimal. It was about $100 total to get the stickers made of a thick enough quality so that they could go over the Coca-Cola images. And then the recycling club replaced the signs in the high school at no cost. So some of the key challenges, I would say, in the beginning of the study were trying to get a hold of the school personnel, even though at the time I worked in the schools, it was still very difficult. And once we found who the key people were within the schools who had some ownership, for example, the athletic director who virtually really owns the gym, that relationship was really key, as well as with the custodian of the school, who also feels a lot of ownership over the school and worked really well with us. So I think finding what will motivate change is really important. And then this key finding of the food pantry storage boxes was really an unexpected finding. And that was something that we really didn't expect to see, and it was a little more difficult to address than we realized because they relied on those boxes. So a lot of the marketing that we did find was not school commercialism, but it was marketing through those sort of unintentional, the boxes, and I would say that was the majority of the marketing that we found, in addition to the vending machines. And then, the result with the city-owned venues is something that we really hope that we can address at some point, but we weren't able to address with this study, so that's a major gap. So I just want to end with some of these implications. I think it's really important to do the periodic assessment in the schools and to have it be part of somebody's role and their paid time. And the wellness policies really should address the food pantry issue if possible. I think that's really important. I don't know how many schools have food pantries within their buildings, but that was something we really didn't expect, and we suspect that's an issue throughout Maine. And we really need to find ways to address the marketing in the city-owned venues. So that's it for my presentation, and Michelle Polacek was the principal investigator. And what I'll do too is put into the chat box her email address. If people have questions about the study, they can email her directly. Thank you.
Great. Thank you so much, Elizabeth. It was really wonderful to just hear about all these success stories coming out of Maine. And I wanted to thank all of our speakers today, Sabrina, Stephanie, and Elizabeth, our co-hosts, the Alliance for a Healthier Generation, as well as the Robert Wood Johnson Foundation for making this webinar possible. And now we have a few minutes, about 15 minutes or so, for Q&A. And we've received a lot of great questions, so we can go ahead and just jump right in. We received a lot of specific questions about what counts as marketing. And I just wanted to point out that we at ChangeLab provide technical assistance on this topic, so please feel free to get in touch with us directly with your specific questions, and we'll be providing our contact information at the end. The Alliance for a Healthier Generation also has a lot of great resources that are helpful and that address this topic. Their Smart Food Planner is a really helpful tool. Stephanie, did you have any other resources that you wanted to mention on that topic?
I just included the model wellness policy in the link in the chat box, so hopefully folks can bookmark that. Thank you.
Great. Yeah, definitely check that out, and that's what the USDA recommends using for wellness policies. So we had some questions actually in regards to a wellness policy. Let's go to this one about someone asked, can you clarify, and I'll turn this to Stephanie, who is responsible for ensuring the wellness policy is in place? Is it the school nutrition director, since they are the ones usually receiving the USDA funds?
It's a great question. So the LEAs do need to establish wellness policy leadership. They have to at least identify one or more school officials that will be responsible for the implementation of the policy and keeping the progress report updated. That is something that they'll have to do as a part of the requirement. That said, the actual monitoring of making sure this is in compliance is probably going to happen during the administrative reviews, which will fall under school nutrition. So it's going to have to be a collaborative effort. Ultimately, it's up to the school superintendent or designee to establish who that leadership is going to be in their wellness policy, but the compliance and monitoring is going to fall within the school nutrition program review.
Great, thanks. And this is a question for Elizabeth. I'm not sure if you know, but how is the school health coordinator funded now? Is it through another grant the district uses, or is it their funds?
That is a great question, and they no longer fund school health coordinators in Maine. They haven't for a few years now, and I believe it may have been out of the tobacco settlement funds, but I'm actually not even sure. Mine was funded through several grants, after the discontinuation of funding for school health coordinators.
Okay, thanks. And then we also received several questions around the Coca-Cola marketing that you mentioned, and if you could just talk a little bit more about that, whether Coke was okay with that, did they sponsor the signage?
Yeah, so a lot of those are still in the schools from many years ago, but for quite a long time now in Maine that has not been legal, and none of the schools get any funds from Coca-Cola currently. Those are just still in a lot of the gyms in the schools because there hasn't been the time or the resources to address that and take them down, frankly. But people are working on that and working on replacing them with Dasani water.
Great, thanks. This is a question for Sabrina. It's a clarification question on events held outside of schools. So they pose an example scenario. Can a school hang up a poster during school for a fundraiser event that is sponsored by, say, Brand X Pizza Company that occurs after school?
Yeah, that's a great question, and that's where you start getting into these kind of complex, how is the wellness policy structured and what's covered. So the baseline requirements, the USDA baseline requirements, probably wouldn't prohibit that unless it's specifically advertising like a specific pizza. But if it just was saying that doesn't meet the Smart Snack standards, but if it was just advertising the fundraiser and the company that was holding it, then that probably wouldn't be a problem. That said, that you certainly could draft a wellness policy and language around marketing that would address that, and that's when I was talking about addressing brand marketing more generally, and then also broadening the definition of what constitutes marketing, that there would be ways to address that. So this might be one where if you have specific questions about how to craft language to address something like that, to contact us offline. But I think that the materials that we have forthcoming will also be helpful in understanding the various options to address those sorts of scenarios.
Great, thanks. And this is actually a question I'll open up to all of our presenters, but can you touch on food marketing on digital platforms in schools?
Yeah, this is Stephanie. I can take that one. When I worked in schools as a food service director, we used to have menu boards that were digital, and so they'd be TVs, and I've seen them in school hallways too. Just kind of we rotated the menu in the cafeteria, but I know that schools will sometimes rotate pictures and advertisements throughout the school campus. That would also fall within having to meet these requirements of the final rule. Now, that doesn't quite necessarily extend to things that might be on school-issued laptops or iPads. We've not seen that yet in the interpretation of the final rule, though we're still waiting for more guidance from the USDA for a question and answer document that they will be providing, and I know that they're currently working on, that will provide some more of those nuances, and perhaps it will be addressed there.
Great, thanks. This is a question about school nurses. If this has come up for any of the speakers, what is the role of school nurses in promoting healthy nutrition and recommending changes in unhealthy food advertising in schools?
This is Elizabeth. I think for the work that we did, the nurse was on the wellness committee and played a really important role in this and in advocating for more healthy marketing.
Great, thank you. How about, we had a question about look-alike snacks, and the question was, does replacement of Snapple that's non-compliant, does placement of Snapple that are products that are non-compliant with more compliant packaging, I believe the question's asking, raise a look-alike issue? So I think it's go ahead. Is that Stephanie?
Oh, this is Elizabeth. I definitely noticed that and thought that was a really great question. And I think, Stephanie, you also addressed that in your slides as well.
Yeah, I mean, I think the question is about the vending machine panel that was replaced. I think arguably yes, it could raise a lookalike issue. That the law in Maine doesn't address, as far as I know, at least not yet right now, it doesn't address lookalike snacks or that issue. So, but certainly, it depends. Again, I'd have to go back and look at the picture, like how similar are and I think also how similar are the colors and the logos, but I think also in that case, and Elizabeth, you can correct me if I'm wrong, but those Snapple 100% juice products are available in and out of school. It's not just a formulation that they made for school. So if they're advertising the 100% juice on the side of the vending machine, it's compliant, and you also can buy that outside of school, then it's not quite the same issue as the lookalike.
Right, I agree. And you're right. They can be purchased within the school and outside of school as well.
Great, thank you both. We're also receiving a lot of questions about the current administration and if there's any anticipated changes or tips for what could be done in the case that any of these standards get rolled back. Do any of the speakers have comments on that?
I'll just say that who knows what's going to happen? I hesitate to predict anything. However, assuming that the federal standards remain a baseline and not a ceiling, that regardless of whether standards get rolled back, if they're incorporated into a local wellness policy or in a state law, they can remain as a state law or the local wellness policy. The one thing I will say is that if the Smart Snacks standards become irrelevant or go away, then there may be some issue of having to define exactly what those mean within the context of the state law or the local policy. But a lot of states and local districts already have their own standards that are the same or stronger than the federal standards. And I would say as you are creating policies, you want to make sure you're also referencing those state and local standards, because in the event that federal standards were to go away, you would still have those local or state standards incorporated into your policy.
Great, thanks. We have a question. I'll kick this one over to Stephanie. And someone pointed out that some schools might not even be aware of the final rule. So what are the repercussions for schools who are not in compliance by June 30th? And then I'll also add what's a way to raise awareness and make sure schools know about the final rule.
Well, certainly if you're working with any schools and you're on the call today, it would be an excellent conversation starter to go back and share that information. But I do know that state agencies are actively communicating this information to local school districts, so hopefully they should be aware of the rule. In terms of the compliance aspect, of course, the goal is that all schools have a revised adopted wellness policy by June 30th, and that it's implemented as early as July 1st. It needs to be implemented right away starting next school year. What I can imagine any follow-up what would happen if they didn't have that in compliance, I'm sure the USDA would likely probably start with guided technical assistance and training to make sure they're supporting school districts to have the resources they need to revise and get a policy that's in compliance with the final rule, but we've not seen any of that yet.
Okay, thanks. And then I was wondering if maybe Stephanie, you or Elizabeth could just talk briefly about the adoption of wellness policies at the school level versus at the district level, and talk a little bit about the role of the school board.
Yeah, I can take this one. So when I was working as a coordinated school health director, I was working and we revised our wellness policy. So for the final rule, they're required to have a wellness policy at the district level. However, I know from working with some of our schools across the U.S., sometimes they go ahead and make more robust policies at their school building level. And so the process is a little bit different for both, and of course it varies from school to school and district to district. But when you're working with your school board, ultimately they likely have a policy committee that's going to be reviewing any of those policies that perhaps is working with their school wellness council to develop that revised policy and going to be taking it to the final school board for what usually is a couple readings before it's finally adopted. And that gives opportunity for public comment. Now, of course, the USDA definitely wants to have that public input and participation in the revision and updates to their wellness policy, so certainly reaching out to make sure that there's representation that reflects your school community from parents, families, students, other folks in the school community that represent all the different areas, including school staff, that having that participation, but ultimately it will be the school board that gives that final adoption. Elizabeth, do you have anything to add?
No, I think that's good. We mostly just worked with the district wellness policy, and then each school had their own plan for compliance with that policy.
Thank you. I think we have time for maybe one last question, and this is about some of the legal issues. We didn't really get into this on the webinar, but I'll kick this over to Sabrina. Are there any issues, or someone raised a concern about food manufacturers fighting back on the grounds of free speech potentially with these marketing regulations?
Yeah, so that's a great question. I didn't cover that because it can get complicated. But the simple answer to that question is while it can be very difficult to regulate food marketing even to kids out in kind of the community at large, schools are a totally different can of worms, and there's a whole set of legal principles that operate in the school setting that make it much easier and perfectly legal for schools to limit marketing on campus. Now, there are some parameters within which that has to operate, but all of the work that we do and the models that we put out take all of that into consideration and are crafted to comply with the legal standards that are in place. So the nice thing about the school setting is that it really presents an opportunity for doing something about marketing that doesn't exist, at least in the same form and as easily out in the community more broadly. And we do have a lot of resources on our website, including, I think, several FAQs on First Amendment issues and the legal repercussions of restricting marketing that might be useful for those who are curious about that particular issue.
Great, thank you. So since we're almost at time, I'll go ahead and just say thank you to you all. If we didn't get to your question today or you encounter additional questions as you're out in the field, we encourage you to reach out directly to our speakers. And as you can see, they've provided their contact information here. As I mentioned, we also provide technical assistance on these issues. And we'll also, as Sabrina mentioned, have some materials that are forthcoming that address a lot of what we talked about today. And then at the end, if you could just please take a couple minutes to fill out the short evaluation that you'll be receiving at the close of this webinar, that would be great. And on behalf of ChangeLab Solutions and the Alliance for a Healthier Generation, thank you so much for joining us today, and have a great rest of the afternoon.